Hello. Well, it has been a very difficult year due to the terrible pandemic, and I have to express my gratitude to the entire Pharma team for their commitment and professionalism. In effect, 2020 has confirmed the company's strategy, which has opted for research and development as the basis for growth, a strong internationalization, and the creation of a robust pipeline. And in 2020, diversification has been added with the creation of the virology area. Despite the pandemic, Yondelis has maintained its sales level as well as the market share. We need to remember that we are the market leaders in soft tissue sarcoma treatment in the label where it is authorized. And Yondelis in the rest of the world has maintained the levels until 2019. In 2020, 7 license agreements have been reached with Yondelis to reinforce our internationalization, thus covering practically all the territories that Janssen previously had outside of USA. And in 2021, we will witness a notable increase in incomes from these partners. Regarding Zepzelca in 2020, we are very happy for the success in the launch of Zepzelca in USA through our partner, Jazz Pharmaceutical, and the trend that has followed since July 2020, where the drug was launched. Our compassionate use program in Europe, in European countries, is having a great reception by the oncologists, confirming that it's a great product and meets a great medical need. In fact, the figures in 2020, you see in the financial statements in France, a great success. In other countries across Europe is the same expanded access, but in different situations depending on the different laws in different countries. Our R&D team has already prepared 2 new compounds that we expected to enter in the clinical phases in 2021, as Pepe explained before. And the virology area, successful complete phase 1-2 with plitidepsin in COVID-19, confirming the preclinical data. So the next 3 years are going to be years of consolidation and growth with important drivers. The financial situation of the company and the expected income from these coming years will allow us to accelerate the development of the products and undertake new projects, important new projects. In oncology, this year, 2021, we will start 2 registrational trials, one in small cell lung cancer, and this trial will help us to obtain a full approval in USA as well as a registration in Europe. And we will start the other important phase 3 trial in mesothelioma in combination with immunotherapy. It's needed to remember that Zepzelca single agent was presented in ESMO 2019, showing interesting activity in phase 2. The other 2 products we have today in phase 1, one of these products will start a different phase 2 trials in 2021, and we want to accelerate its development and to see it in the market as soon as possible. We also expected new approvals from Zepzelca, the small cell lung cancer, in different territories, and new license agreements are coming. In these different countries, the dossier is already submitted. It's a different process in different countries. Then we expected new approvals across this year. Regarding Yondelis, it's a mature product, and Maria Luisa said before. We expected in 2021, and volumes of sales seem similar to 2020. However, we will see how the pressure on prices evolve, mainly in European South countries. Also, in 2021, the commercialization of Yondelis in the rest of the world will begin through our partners. We expected that both in 2021 and in subsequent years, an important growth in sales and incomes from Pharma. Regarding Aplidin, we announced in 2020 we win the appeal in the Luxembourg court regarding the decision of the European Commission regarding Aplidin and multiple myeloma. Now, we expected the new timelines from the EMA in order to see what is follow this process, because it's the first time in the history occurred this success. Regarding virology area, we will soon begin the recruitment of phase 3 for the treatment of COVID-19, and during 2021, we await the results of this trial. If these were positive, it will lead to a registration. The model we expected to sell the drug if the drug finally is approved is a similar model that we follow in oncology area. Plitidepsin, given its particular mode of action, we believe that it can work in other types of viruses. So we do not rule at the beginning of other studies in different types of virus. Already in 2020, we have started to search for new products to incorporate into our sales force in Europe through a licensing in, obviously in oncology products, in the registration phases or close to it. Our commercial capacity and expertise for sales, we have a large sales force, very experienced, more than 10 years experience. Our capabilities demonstrated in market access, medical marketing, medical affairs, etc. We have capacity to have more than one or two products at the same time in promotion. With all of this, as I already said, in both 2021 and following years, the company is going to experience a period of consolidation and grow with great challenges ahead.
Thank you. As a reminder, if you wish to ask a question, please press star 1 on your telephone keypad. And the first question comes from Samir Devani from RX Securities. Please go ahead.
Hi everyone. Thanks for taking my questions. Congratulations on the results. I've got a few, perhaps just kicking off with things just to help us a little bit on the modelling. You mentioned on R&D that you expect it to rise, but modestly at first. I just wanted to get perhaps a bit more of a quantitative feel on that. So are we talking going to 60, 70 or more million this year? Second question is just on diagnostics. I was slightly surprised by a lower number in Q4. Perhaps you can just talk a little bit about what you expect for this year. And then third question is just on Solentis' dry eye trial. Just wanted to confirm that you would need a second phase 3 trial before filing for approval on that. Thanks very much.
Okay, thank you, Samir.
Well, as we mentioned before, we have plans for the 3 phase 3 trials, one in small cell lung cancer, other in mesothelioma, and the other in COVID-19 for Alpridin. The oncology trials is for 3 years investment, more or less, but one of the trials is COVID-19, is only for this year, this large trial, and it's not a lot of expensive then. But we expected this year, 2021, is the R&D expenditure we will increase for the COVID-19 project, but in following years we will remain on intermediate levels on 21 and 20. Then the major increase we will see this year, 2021.
Regarding the question for Genómica, the reason why the sales are weaker in the fourth quarter is because of the pressure on prices. The price of tests has decreased since the first moment in which we start selling. Now are more variety of diagnostic tests, etc., more competitors. The price has decreased.
Hi, Samir. And in regard to your question on dry eye, yes, we'll need another phase 3, at least 2 phase 3 trials. They'll be in dry eye related to Sjögren disease, which is what we saw in our previous trials. I believe we have one that we're expecting one of them to start this year. Is all almost everything ready to start. So we're just waiting for a few things to start. Hopefully we can start both of them this year. We'll do it, but at least one will start this year.
That's great. That's very helpful. And perhaps just one more, just on the compassionate use sales of lurbinectedin in Europe. It looks like you achieved around 8 million in Q4. Is that a fair run rate going forwards?
Yeah, well, the compassionate use that you see in the financial statement was so interesting. We start year 21 even higher than we closed. Then this is 2 important facts. First of all, the Atlantis result is any impact in the use of the drug. Remember, the Atlantis trial was in combination with a lower dose with the lurbinectedin. And the second one is a huge medical need. The reason why the 95% of the incomes come from France is because France is a special program. The name is ATU, A2 in French, and probably we expand in other countries across Europe. Not a lot, because this is a special program to access for the drugs where the drug is not approved yet, but is in clinical trials, is not in all the European countries. Personally, for your information, was approved in December in Austria, this type of reimbursed compassionate use. And in South European countries, in Spain is possible, but the issue in Spain, even in Italy, is the budget constrictions was announced by the authorities. In any case, in some countries is open. And we plan now, if it's convenient, to open in parallel to the small cell lung cancer compassionate use. We are analyze if we will open in mesothelioma, because we are still start to receive a lot of requests for compassionate use in mesothelioma in different European countries. Okay?
That's great. Thanks very much.
Our next question comes from Christian Glennie from Stifel. Please go ahead.
Hi, good afternoon, guys. Thanks for taking the questions. Maybe start with a few more on the numbers, just for clarification. Firstly, on the oncology sales, you talked about a sort of 100 million euro revenue, of which sort of 73 Yondelis, 21.5 Zepzelca compassionate use. So I'm just wondering what the balance there of sort of about 6 million euros was for.
I didn't catch the question.
The last one.
The difference between, Christian, could you repeat that one? We missed the last part. The difference between...
Yeah, so you booked about 100 million euros of oncology revenues. Yeah. Roughly 73 was Yondelis related. 21.5 was Zepzelca compassionate use.
Yeah.
So what's the balance of about 6?
Sales of active ingredients for both Yondelis and Zepzelca. We sell the active ingredients amounting 9 million euros.
Okay, active ingredient sales to pharma partners,
yeah,
but not necessarily market.
Exactly, to our partners, yeah, for both products.
Okay. Thank you. And then on the Jazz deal milestones, you recognized about half of the total amount in 2020. You previously, just to clarify, I think, said you were going to expect to book about 80% by the end of 21, and then the remainder in 22. But in your comments, I think you said just 40 million to be booked in 21. Is that correct?
Is that correct? We recognize about 50% in 2020. It's already done. Yep. And for 21, we expect to recognize, to boost about 40 million euro.
And therefore the rest, the remainder
and then in 2022, similar amount, 40 million, and then it will decrease the amounts for several years ahead.
Okay, so even beyond 23.
Yes.
Okay. Okay, thank you. In terms of and then just to clarify, in terms of the trials, then the R&D strategy on Zepzelca, it sounds a bit like you are charged with running the confirmatory monotherapy trial and cover the cost of that, and then Jazz is then conducting an additional trial in this bio-maintenance phase. Is that correct?
Yes, it's correct. We will conduct a trial. We will use for confirmatory trial in New USA, we will pay that, and this trial is the sign to use for European approval too. Okay, a part of that, Jazz, we will start, they announced, they'll start a phase line maintenance therapy trial, but this will be paid by Jazz.
I'll be paid by Jazz. Okay. And then some rough sense of time, size of trial and timings of the monotherapy, and I think Pascal said it was third line.
Well, we will disclose the timelines, but you need to consider, I can say some items for your consideration. The trial, we don't expect that more than 400 patients, even less. 1 year treatment in compassionate use in France, we treated 600 patients, okay?
Sorry, what was the France bit?
This trial, we don't expect that more than 400 patients to include, okay? Now is in discussion with the authorities. But if you want some reference, in 1 year in France, only in France, we treated in compassionate use more than 600 patients. Okay?
Right, okay.
Okay. Thank you.
Okay, thank you.
Thank you, Christian.
Our next question is from Alvaro Lenze from Alantra Equities. Please go ahead.
Yeah, hi, thanks for taking my questions and congrats on the good results. I just have a few questions on the Zepzelca clinical trials, especially on mesothelioma. I was wondering whether your agreement with Jazz incorporates any sharing of the expenses of conducting the trial, or whether this expense will be taken on by PharmaMar alone. Also on the pipeline on virology, whether you have any specific viruses in mind in which Aplidin could be useful, or whether you have any other molecules in the pipeline for virology. And lastly, regarding capital allocation, whether you have any preferences or priorities regarding where to deploy the strong cash position you have, whether in M&A, in licensing products, or stepping up internal R&D. Thanks.
Well, regarding the question for Aplidin, in what I say before, we know in Aplidin, we know related to a particular mechanism of action, the drug have very high opportunities in other viruses. Now, we are still analyzing the potential application in other viruses. When we will start the other potential trials, we will announce, okay? Regarding mesothelioma, in principle, we will conduct the trial independently if the Jazz is joined with us or not, because we consider this is very important. Then, if Jazz want to add it, they have the opportunity to add in our trial. But in principle, we will move forward for this trial because, according to what Pascal was before, this is an interesting opportunity to grow the drug. One of the reasons because we want to move forward with mesothelioma is because you need to consider in Europe the incidence of the mesothelioma patient is about 3 times higher than USA regarding to use the asbestos in the past. Second one, we conduct in Europe was an IIS trial with the Swiss oncology group, and they presented in ESMO 2019 a very good results for this trial in single agent. Then we proved in phases 1 the combination with AIO is very feasible. We achieved the full dose for both drugs, immunotherapy plus lurbinectedin, without any increase of a safety profile of this combination. Then we perform a large key opinion leaders meeting across different European countries. All of them are very excited to start this trial. Then the market is there, the patients are there, then we consider to move forward regarding these products, independently if Jazz joint or not, for mesothelioma. And for licensing in is, I explained before, is a very important point for us. In fact, we just started last year to have a large screening for the market, and we want to materialize this project this year. our BDL team are strongly working this. Is a different model for licensing in, and the second one is a negotiation process. Then we will see what will be the final deal. Okay. If your question is regarding if the allocation capital for big upfront or lower upfront payment, more milestones, or more royalty stream or profit sharing, it is not decided yet. Depends case by case, drug by drug, etc., etc. Okay. Pascal, would you want to add something on the BDL?
Sure. So I'm working with the team on this. I'll just give a brief recap of what how active we were in 2020 is looking. And of course, this is BDL is a little bit like baseball. It's a game of failure, right? You rarely do deals and look at a lot of them. We looked at over 100 solid tumor assets or companies, not supportive care, so therapeutic agents. We whittled it down to a short list of single digits. We made a non-binding offer on one of them. I don't know if we should be happy or unhappy, but the company ended up being bought shortly after we'd done that. So I guess the asset that we were interested in had appealed to someone else as well. We were ready to make a second offer, and that company changed strategy in terms of what they're trying to do. So we're redoubling our efforts. We're streamlining the process internally, and of course, BDL takes two to tango, so we're not going to say we're going to do a deal in any certain period of time. It takes two to do that. What we can say, I think Pepe mentioned this, we have a lot of flexibility financially. We're not going to say this is the maximum we'll do. We're flexible. We understand we have to come up with a term sheet that's acceptable to the seller as well as to PharmaMar. We are open for business. Thank you.
Okay, thank you very much.
Thank you. Seth, I believe this is all from the audience on the phone. We have a few questions in written that we've received. Some of them have been answered over the remarks and these questions now. Some others, all those questions related to details about, our agreements with our partners or financial details has not been disclosed. Of course, we cannot take because it's information that has not been disclosed. And we have received many questions about different topics. So what we'll do in order to, be able to address as many as we can is we'll group them in items or by subjects. And the first one will be our group in relation to Zepzelca and the compassionate use program. We've been having questions, Luis, in regard to other countries other than France, or what we can expect.
Well, in some countries it's possible to invoicing this type of standard taxes reimbursed. It's like France, Spain. My situation was Austria. In other countries it's impossible, but then it's open now, reimbursed in Austria and France and Spain. But like Spain, Italy, Portugal, is budget constrictions regarding to pay this type of standard taxes. But in parallel, I mentioned before, we now are in analyzing process to open for mesothelioma, because we received a lot of requests for mesothelioma across Europe, mainly in Netherlands, in Switzerland, even in France. And now probably we will open this standard access program for mesothelioma. But repeating, not in all the countries it's possible to open this.
Okay, thank you. Also in regard to Zepzelca, and this will be a question for both, for Luis and for Pascal in New York. We have received questions about the potential impact that the Atlantis may have in potential approval of Lurvi or other approvals in Lurvi, and in the U.S. That'll be for Pascal. If that will have any impact on their sales or any other impact in the U.S.? Luis, if you want to take.
Yeah, well, regarding Europe, obviously this trial we can't use for submission because at the end of the day they don't achieve the primary endpoint. And what I said before, in this new trial we start very soon this year. We want to support even from USA for approval, even for European approval. It's important to remark the Atlantis trial never was designed and agreed for any for USA or for a confirmatory trial. Then in any case, it's not. Regarding Europe, what is interesting obviously is a delay for launch in Europe, but instead combination will be a single agent. Remember, the combination is only 2 milligrams per square meter by patients by cycle. In the single agent is at 3.2 milligrams by patient by cycle. Then, even it's a delay in the global project in 10 years, probably the economics are much better in this situation than the other, even with the delay in 2-3 years. Regarding USA, if Pascal want to add something.
Sure. So, from what we can tell, and of course, maybe this question needs to be directed towards Jazz. They have the weekly numbers, and we don't. But from all the public commentary about Atlantis, it seems that the physicians in the U.S. understand that it's a totally different dose, like Luis just said, a much lower dose, and have concluded that the lower dose, which was done to accommodate doxorubicin and its own, whether it adds or doesn't, the doxorubicin didn't end up pulling its weight. And so there really has not been a significant discussion. And I think it's partly because they understand the dose, and partly when you think about, well, what's the alternative, right? Topotecan was a monopoly that had under 20% market share in second-line small cell before we got approval for Lurby. So you must have something going on that's not great if you've got 20% market share and you're a monopoly. And since we've gotten approved, a lot of the sales that Lurby's got have been replacing Topo. So even if one is concerned about Atlantis, one would question, well, am I going to really go back to Topo? That doesn't seem very realistic. So we don't expect significant impact from Atlantis at all in the U.S. Thank you for the news.
Okay. Thank you. Changing subjects now. We had quite a few questions about the timeline of plitidepsin, of Aplidin, in regard to COVID. I believe Luis is covered in his remarks, but I don't know if you want to, mention again or. Well,
the Aplidin trial for COVID-19, the phase 3 trial, now is we submitted already the protocol for the authorities, and is in the discussions with the authorities to achieve the green light to start this trial. We already have the vials prepared, the CRO to manage this trial, the insurance policy, the infrastructure to start. They're only waiting the final decision for the authorities to start. As far as you know, this is a typical bureaucracy to start this type of trials, okay? In UK, we announced that the trial was approved by the MHRA, the UK authorities, and now is the next process to start, and it's different than the other ones. This is the pivotal trial. Is the other trial we want to start is the palsy symptomatics. This trial is the discussion with the authorities too. Then, as soon we will start, we will announce. We don't expect it to have a lot of time for recruitment at the actual level of the pandemic. The recruitment is expected about 3-4 months recruitment. The data are not oncology. Then we don't need to wait for overall survivals for 1 year. Then for all of that, if we start the trial even in March this month, even in April, we expected to finalize the trial and to know the top line results in the last quarter, but depends on the two important items when the authorities decide the green light and the level of the pandemic.
Okay. Thank you, Luis. Finally, we had a couple of questions, or a few questions as well about the potential listing in the PharmaMar in the Nasdaq. I'll take that one. Basically, as we've been mentioned throughout the call, we have quite a few things going on this year in terms of strategy. And just to remind you as well, the accelerated approval moved forward our calendar, strategic calendar, 1 year. So things are happening a year ahead of what it was planned. And then we have a few things on the plate. I mean, after what we've mentioned, we're going to finish this year with at least with 2 phase 3 trials with the Telca and the pipeline, with at least 1 or 2 more phases 2 with another raw compounds in the pipeline, 2 more molecules going into the pipeline in oncology, a phase 3 trial that will start in dry eye, plus what we've mentioned about these in-license activities that we're doing now to in-license a compound to distribute in a sales pool. Not to mention what Luis just mentioned about the COVID. And with plitidepsin and the phase 3 that we expect to start shortly. So there's quite a few things on the table these days, and we have to concentrate on our strategy. And I'm saying all these because we first want to concentrate on our strategy, make sure we achieve all these goals by the end of the year, and we absolutely convinced it is going to add value to the company, and then we'll think about it. So we perhaps going to give priority to all these strategies rather than listing on the Nasdaq right now. We're going to concentrate on that. So we're going to leave all these listings in standby for the time being, and then we'll rethink about it in the future. But we'll have to concentrate to make sure that we achieve all these goals. They're very challenging. We believe the company is in a transformative time. We want to push the company even forward. So basically, to answer that question, we'll concentrate on the strategy and leave in standby by now. Before we finish, we have a last-minute question from Samir. Seb, I think we'll take that one, and we're running out of time, and that'll be the last one.
Thank you. Samir, please go ahead.
Thanks, Gerald, for taking the extra question. It's really quite a simple one. Just on the dividend policy, obviously there's quite an increase in dividend this year, and you've talked about EBITDA obviously being less this year. Perhaps you can just comment on what the dividend policy is and whether we should still think of this as a progressively rising figure. Thanks very much.
Right. Thank you, Samir. We have not been commenting on the policy in terms of the percentage of the amounts, because as we mentioned in different occasions, our main priority is R&D investment. Luis mentioned in his talk before, and we will approve on the dividend, on the amount of dividend on a yearly basis. I mean, the board, I will propose to the annual general meeting to approve on that. Being my priority or investment and making sure we can comply with everything we need to push forward all of our trials. We are confident enough we can carry on paying the dividend throughout the next few years. So that is our intention. We will continue paying dividend. What we cannot confirm or we cannot mention now is the amount of that dividend. So that will be signed on a yearly basis. The board will propose on a yearly basis to the general meeting.
That's great. Thanks very much.
Thank you. All right. I believe this is all. Thank you, Seb, for your help, and I would like to thank you all for joining us to our conference call. For those who would like to meet with the management, we'll be participating in the Credit Suisse Virtual Healthcare Conference on Thursday, and we'll also participate at the Barclays Virtual Healthcare Conference the week after, on Thursday the 11th. And I hope